Today we celebrate the launching of the first ever National Drug Use Survey, which presents the estimation of drug users in this country. Illicit drug demand in the Maldives is rampant. According to the National Drug Use Survey report, an estimated of 7,496 people aged between 15 to 64 years are substance abusers. In Malé, there are 4,342 estimated substance abusers, while in the atolls, there are 3,154 users. About 96% of the current drug users in Malé are aged between 15 to 34 years, and about 90% of the current drug users in the atolls are between the ages of 15 to 34 years. According to the World Drug Report, current global trends are towards cannabis, and this survey has also found that this trend has been set for Maldives too. These figures themselves explain the depicting seriousness of substance abuse prevalent, especially among the youth population, which is pretty much the workforce in this country. You will see extensive details in the presentation tonight. Since the treatment of drug users began in 1997 to 2012, to date, the National Drug Agency provided drug treatment for 4,000 drug users. The ushering of the new drug law, 17/2011, has been most impactful in changing the concept from punitive approach to treatment approach for substance abusers. The Drug Council is now vested by law with powers of making drug policy and advising the President in the formulation of key drug policies and strategies. And in the wake of these new evidences and developments with the release of National Drug Use Survey report, it may now be important for the government to formulate the National Drug Control Strategic Plan, the National Drug Prevention Strategy, and other relevant and important new policies as required. The National Drug Use Survey has alerted and indicated that there are many substance users in the community who need to be channeled into treatment. Engagement rather than incarceration and treatment rather than punishment underlies the essence of the new drug law. Hence, with such a law and with the evidence generated by this survey, it may take years to provide treatment to the drug users unless the extensions for the rehabilitation facilities are secured. It is important to note that prevalence of such substantial number of drug users are concentrated in such a small dense area like Malé, for example, will serve as a seasoned ground for future evidence-based studies and research both at local and international level. No survey can be conducted without the availability of data. Hence, I would like to thank all those volunteers and field staff who work throughout with great enthusiasm, conducting structured interviews around the country, collecting data for this survey. I also want to express my appreciation on behalf of the government, the important contributions made by Innova Private Limited for conducting the major work for this survey. It is with great pride I would like to state that the survey was conducted by the local team, Innova, who have done a commendable job. The data received from the survey will be sent for inclusion in the World Drug Report of 2013. I extend my gratitude to the NGOs who mobilized their workforce, which was instrumental for the survey, and I applaud their contribution. The European Union has generously funded this project, and I thank the EU for contributing to the social development of Maldives and for their commitment to implement better systems of governance. United Nations Office on Drugs and Crime have been the driving force in facilitating the drug sector-related programs, and I would like to thank UNODC for their contribution and dedication. Finally, I would like to thank His Excellency the President of Maldives for giving all the support necessary in 2011 when we first began the groundwork for this survey. Lastly, I would like to state that the results of the National Drug Use Survey is no doubt a great investment for the government in achieving future demand and supply reduction objectives. Thank you.
Thank you, Honorable President.
Today, we are launching yet another report containing data and information that is extremely important in growing policies related to the well-being of our society. For this, I have to thank UNODC, the EU, and those involved in the successful completion of this work. I'll let you digest the data and statistics we just saw. In the meantime, let me take you back to 2006, when, while developing our second HIV/AIDS strategic plan, a situational assessment was done to better understand the areas that need focus. It was concluded that substance abuse, sex work, and injecting drug users were identified as among high-risk groups that required urgent attention to avoid an HIV outbreak. In 2008, our first biological and behavioral survey, we found that close to 50% of the ID use unclean and used needle, while unprotected sex among sub-cohorts of ID use range from over 50 to over 90%. The good news then was that there was no HIV positives found among these high-risk groups, though the risk of an explosive HIV epidemic was extremely high. Our worst fear came true in 2012, when HIV was detected in a substance abuse victim who also had a history of IV drug use. In 2009, our first global school health survey, targeting students between the ages of 13 and 15, we found, among other things, that 5% of students drank alcohol on more than one occasion during the first 30 days. And among the students who ever drank alcohol, over 77% had their first drink of alcohol before the age of 14. We also found that 9% of students smoked cigarettes on one or more days during the past 30 days, while 74.6% of those who ever smoked tried their first cigarette before the age of 14 years. We know that both tobacco and alcohol are gateway to more dangerous and stronger addiction, as we saw just now as well. The reason I'm repeating these facts is because I see the statistics are clear. I see these statistics as clear warnings on the gloomy picture we see on the health of our youth and our future generations if we don't take bold and effective measures today. Drug abuse has become the worst enemy of our development, a threat to our security, leading to organized and violent crimes and corruption. It has become one of the most significant public health threats, putting the drug abuse victims and through them the general population at increased risk of contracting serious infectious diseases such as HIV, hepatitis, and tuberculosis. It is of concern that over 15 years of substance abuse prevention, spent in millions, have not shown the results we all hope for. Perhaps it is time to take a break, take a stock of what we have been doing, and strategize on what needs to be done differently. Modi simply cannot afford to go on dealing with this social, public health, economic, and developmental issue without tangible outcome. A more holistic approach is required, addressing the cause of the causes leading to substance abuse in the Maldives. We must understand that there are no safe drugs and that alcohol and tobacco use are equally damaging, leading to more serious addictions and associated health and social issues. Being a health minister, I am extremely concerned by the fact that certain groups of our society take alcohol and tobacco as acceptable and less risky behaviors, while evidence confirming otherwise is ample and increasing. And also when the rest of the world is uniting to fight against these high-risk public health and social problems. I urge religious scholars, public health experts, educators, parents and policymakers to sit together and find local solutions to our problems based on facts, local evidence and best practices from other countries. A piecemeal and ad hoc approach to substance abuse will not give tangible outcomes. Law enforcement authorities, NGOs, health and other sectors need to work in close collaboration in prevention, treatment, rehabilitation as well as supply reduction in our common fight against substance abuse. I would like to thank the personal commitment and guidance from His Excellency, the President and the Vice President in the work of the National Drug Agency. I would also like to thank the members of the National Drug Council, NDA board members, local NGOs, international partners who have joined hands in this important work. It is my sincere hope that these efforts yield tangible results and that it provides for a healthier, safer and more economically vibrant society. Thank you.
I would like to first of all thank the Ministry of Health, and in particular the National Drug Agency, for undertaking this very important national survey on drug use. I would also like to thank the United Nations, particularly UN ODC, for providing the technical assistance and coordination for this job. Particularly thank the European Union for the financial assistance they provided for this project. I must thank Innova for doing an excellent job. Over the last about 2 years, they've been working on this. Almir Alwomen mi Falpra report ki mi Gaumi Femberga Mihatana at the Hedunwa. MFRTM survey, the Virajega, Maswati, Berumpra, Mihuna Pego. Emima, Miss Survey, Hede Masha. Adi, Mi Kaunga, drug control Pumataka, Purava Masekatla. Alon Fritamas, Marakas Shupradano, Virajega, Nabrais, Numabahidino. Adihame, Emermo, Minister of Health. Dr. Jamshid Nikamga Deba Irshada Intikam Takaras. Mire or a Khas Shukure Avan Ratupan Jehe Farataki National Drug Agency ke Chairperson Al Ustaza Lubna Zahir Hussain. Adiyam Meru mi agency ga Maseke Korba Hoya Befunasha. National Drug Agency के बोर्ड के मेंबर ना तोड़ना कोशिश करता हूँ. आज मेरे मी शायद प्रवन रिपोर्ट मिवारा मुहिम रिपोर्ट राज्य का मस्तवाद के बेनु प्रमुदा मिहिम गादत गिनाव मुदातम अगुन एम्मे नहीं के सरकार को फरातम मस्तवाद के बेनु प्रमुद टुमा टका प्रमुगेंदा मासे कितना बिस प्रमुगेंदा तावरगे ज़मान बिच Nedu ke be important argument na barat tafsil malumat take dibe engage. Ek tere emme muhim e malumat ki misave hedi mihum ke tere e muru fanadara pastos atarvara denedu ke mihum ke tere argument na fahak previje gaidno ka hang has fasite ke mihum Masuk di bawah program genda. Then mire temen ke yuda me pada masuk di bawah Qurani ki hame kan numur ke bawah besme. Everen hagu kudi mes eba bawah Qurani, everen doshi bawah mes eba bawah Qurani. Emi mi ada ki mi adi muli abadiga maswata ke timi benu kurani ki jadanu miyavre ma bodu adade onnane kama algonda tafakure algon me kuri andaza kuram india adadaki gadanda ka dihwarkan has mihum benu kuram de ehima algonda adios mirene sama hiwani am dihwarkan has mihum bene de rajye ko maswata ki benu numbers mi reportum mi libun malumat na chadina ko fa algona ebe ege wara tafsil ko hong kong baawati ke mihun kan hong kong umre ke mihun kan hong kong baawati ke maswata ke chikkan benu prom mi gendan algona me idame paakura ekamaki bara live kuni maswata ke benu prom genda ko mi reportum me salgona paage ginech egotum demmega khasako algona minister edebi malumat abisna wadanna ayuga school dawruga school umurufraj kudin dagana grade ashagi kudin khasako bargina aldeki kudin go benun kure mastwale nikan ne behinga mare guys arotelega ane kamirege mi survey malumat dibun gotuga algona ebe enge udapudi mastwale ke benun mi kurani maganu desawka esawaki majala anesawaki goppala daganaka timbakula ebakudi ehen kommes mihegge nufuzga majbur wege kaagorka ni benu kura gina kudi me benu kurani hama ajma bayana majala ehme mi alwamna ngebe jehe mikanga mi libe malumat ko macho bina ko fa mi qaumge talimi siyasata zuwanuna behe siyasata mi qaumi siyasata ka deterega a visnu algunne ebe jehe visnu adhame mi sarve dakka gutwa fidenu nambren anghino madu benum pura kama bara borta madu kama dige bitakkan එහෙනම් සම මේ report එක එබබනේ maswata ke ben kura firheno emme gina emme hununge baaverin gotuga ben maswata ke ben kura hinu එහෙම ජා මිසාවෙ නොදක්කා මාලුමාත් එක්ක එසෙපො මෙදෙන විපාර පිටම මාලුමාත් එක්කෙන් අදි අලගොන්න ඉතුරු හොදෙන් ජෙහෙ කන්කනේ බහුරිකම් මේ report හුම් වරංග අලගොන්න වෙන साफ करें इंग्लिश अदिया में है मेरे अलगोन में ना एक इंडिया एक काम की ऐसा अलगोन में ना आइए तो नहीं गए काम में ना मैं इस साफ को मेरे रिपोर्ट हूँ अलगोन में कहेंगे मेरी राज्य का मसला है ये उनको आप दिन ये खिदमत तो होगे तेरे पूरी खिदमत तक एक को लीमा एक वक्त का खिदमत दे रही थी हमें करनी सकते हैं दिया तक फरवा पेरुंबा तम मी रिपोर्ट से बताता माधुरगे हैंग आसपास देखेंगे बिग माने की अरबन में ना मिहातना नदी पुरवे मसेकत के साव मीग हम किरिया आदि माथि की कहा दे मस्तवाते के पेरुं पुरा खुदिना देंजे फरवा दिनुंगा आदि हम उड़को बेस अरबन में मसेक पुरवे वर नुपुरवे कम मीगे वर रंगला मेरे फावल के लिए मेरी रिपोर्ट के भरी बारह गिरा मालूमा ये भी मालूम इल्तिमास कौन नेशनल ड्रग काउंसिल ला नेशनल ड्रग एजेंसी के फरातुम मेरी रिपोर्ट रंगला दिलासा करोगा रिपोर्ट बा पूरी मालूमात तो के मंच बिना करोगा अल्गुन में ये सियासत मस्तवात की कंट्रोल को मटका अल्गुन में मिगेंगुले सियासत अलुम गौला करोगा ए सियासत के नोएं जो बदलते देने हो अभी नेशनल ड्रग कंट्रोल एक्शन प्लान अथवा स्ट्रेटेजी तक अलुम फिर दें हमें आया कीगा मेरी रिपोर्ट के मालूमात में बहुत तक बिहार स्कुला को मोरिहा कमा बे फरात तक अंगवादे खासको मी मालूमात रुझे अरगुन नंगे कानून हदा मजलिस सरा अरगुन नंगे कानून तंफीज पुरा कोर्ट तक्षा निहुरिया खरात का उस मालूमात काफी को दर मिकां अरगुन न कुरेनी मिकां कुरमत का एकशी गंबा वसीलत निदिगे एह मीमा अरगुन देने भी अरगुन उम्मीद पुरा मी रिपोर्ट का मी एंगिंग दिया मालूमात तक माचा बिना को सियासत तक रूमा एकीगा सियासत तंफीज को बेनुबा रिसोर्सेस वसीलत का उदिया फरातक मोसागम ने निदिगे दाने का अरगुन निमासे के तिबेटों को देवी कमेंट का और बड़े शुक्रदानो निवार गिना तो मासे के कोके नतीजा में मेरे बुनी एमिमा नी रिपोर्ट ये बेनु ये हम लोग का उदिया फरातक मोस इप्पे मांग अरगुन इल्तिमास करो अदि निहार हेक्फावा कानून के दशुं निवानी मी प्रोग्राम हिंगुम टका मी हिंगुम गे ओनिगंडे कंडेरिफा एकम बेनुवा कानूनी बारवरिकं लिबिफा नेशनल ड्रग एजेंसी की निहार हेक्फावा गतुं बलगिना भारत के लिफावा एजेंसी है बलगिना एक सरकार के वजारत का एजेंसी तक विदर्शपुरम के बाद लिफावा एजेंसी एवं मी एजेंसी मिहार बरन स्वागत करवा एजेंसी प्रियम गोतुगा इफेक्टिव तनिकमगा अद्वादे मार्गो बरबड़ है निकमगा सरकार को फरात मिहार बरबड़ मासिक पुरगुमंग आगो एक बेफुना दनो अदिया मेना की गनकम कुरमट का बेनुगा एही तरिकम बेकुमा एहन सरकार के मुस्सा तक बेसागो इल्तिमास करदानो मेरी रिपोर्ट निहा तुयम का निर्माण देवी कमन चका अदिस्ते फहत के बिहा बेतना वाला प्रदर्शन करदानो अस्सलाम वालेकुम
For their support and valuable contributions, Journey the NGO. SWOT Society for Women Against Drugs. Open hand. Freedom. The certificates will be accepted on behalf of Freedom by hand in hand. Thank you, President.